Hi, good night. Thanks for joining again. I'm hoping it will be a larger audience tonight. Okay, we're up to 2. Once we get up to 5, we'll start. Up to 3 now. Just waiting for 2 more people and then we'll start. All right, let's start. So tonight we're going to go back through what we covered earlier today, which is menopause and weight loss. Now let's start with the definition of menopause. From a clinical standpoint, menopause is when your period has been absent for at least 12 months. If you are having irregular periods, that does not mean that you are menopausal. You can be perimenopausal, meaning that you are about to go into menopause. People who can go into menopause are either around the age of 50 to 51, which is the average age of menopause in the United States. People who can also get or go into menopause if they have radiotherapy or radiation done on their ovaries for tumors, if they undergo chemotherapy, if they have had their ovaries removed, which most times can occur when you've had a total abdominal hysterectomy, which is the womb removal. And if the surgeon observes that the ovaries look suspicious, meaning they look like if they could have pathology, the surgeon may very well remove the ovaries at that point in time. And depending on when this surgery is performed, it can send you straight into, or eventually it can send you into, menopause. Now, symptoms of menopause: vaginal dryness, breast atrophy, meaning your breasts shrink. You can have hot flashes, chills, depression, anxiety, mood swings, insomnia. These are just some of the symptoms that you can have. Some people experience lightheadedness, dizziness, but the worst symptom that people seem to get, hot flashes. Other symptoms and signs would be weight gain. And this occurs as a result of the menopause directly, because menopause is as a result of your estrogen levels decreasing. And this is a naturally occurring thing that women will experience, event that women will experience. Now, when this estrogen decreases, there is an effect on your metabolism. And as this effect is elicited, you will note that if you're a person that's inactive, you will note that you actually find it easier to gain weight. You find it easier to, your clothes fit tighter. You just feel much more unhealthy and lethargic. You have no energy, so you're less active. Treatment of menopause. Let's start with the main treatment modality is hormone replacement therapy. Now, hormone replacement therapy involves either giving progestins and estrogen. Now, the progestins and estrogen are given if you have a uterus present. And if you don't have a uterus present, they give estrogen alone. What can happen with this is that it can help to reduce some of the symptoms and signs that occur with estrogen withdrawal that occurs from menopause. Estrogen can also be given in the form of pessaries or creams to be placed in the vagina in low amounts to help with the dryness and atrophy, meaning the shrinkage that occurs in the vagina. Other things that you can get, or treatments that you can get with for menopause, people may prescribe vitamin D and calcium. Now, because of the withdrawal of the estrogen that occurs within menopause, what can happen is that you can end up with osteoporosis. Now, estrogen helps to combat the effects of osteoporosis, but as you get older, especially in women, the bones become more brittle. And because they are more brittle, the reason they become more brittle is because the effects of estrogen on the bones is reduced, so the bones become more brittle. So that's why when you saw my video and I was talking about menopause, my advice was to increase vitamin D and calcium, along with hydration. Other things that you can use is bioidentical identical chemicals, which are chemicals similar to estrogens, which is the hormone that I just told you about. And what this does is to help to reduce the effects of the withdrawal of estrogen that occurs in menopause. But research is still ongoing, and as such, the overall effectiveness of this treatment is still not clear. Other medications that you can use, phytoestrogens. Phytoestrogens are found in soybeans, flaxseed, lentils, and chickpeas. These are phytoestrogens, are estrogens derived from plant matter, which can help with the effects that you feel during menopause. However, again, more research is needed and the effectiveness is not really clear. Other chemicals or herbs that you can use, black cohosh, more research is needed. St. John's wort, which is used for your mood swings, more research is needed. Evening primrose, people claim that it does help. There is DHEA, which is used by many people, and they report that they do get some positive effects when using DHEA. And another treatment modality would be antidepressants. Now, antidepressants such as pregabalin or Lyrica, there's a whole host of them that can be used, and people do use them to combat some of the symptoms which occur, like hot flashes. There's also a watch that people place on their hand, and this watch, when you feel a hot flash coming on, you press it and it emits a cool sensation which can help to reduce the effects of the hot flash. So now that we've gone through this, let's just talk about differential diagnosis, meaning if you are experiencing so-called hot flashes or symptoms of menopause, what you should also be investigated for, especially if you're not at the right age of 50, 51. There are some people who go through menopause at a younger age, but if you're a person that is pretty young and you start experiencing hot flashes, you need to get your thyroid checked. That's one of the main things you need to get checked. Your heart is another thing you need to get checked, because your thyroid, if it's overfunctioning, can give you that same flushing effect. That flushing effect where you feel hot is as a result of if your thyroid hormone is very high. If it's very high, it can give you that effect. It can also give you that anxious feeling. It can also cause weight loss. But the thyroid, which is a gland located underneath the neck, right here, it should be checked. An executive medical should also be done. And if you're a person who wants to do estrogen replacement therapy or hormone replacement therapy, you should know the risks as well. So you need to have an executive panel done. You need to have an ECG echo done as well too, because hormone replacement therapy comes with its risks. If you inject estrogen into your body as a woman and you have a womb especially, it can precipitate endometrial cancer or endometrial carcinoma. So it puts you at risk of developing endometrial cancer. It also puts you at risk of developing breast cancer. So people who undergo hormone replacement therapy, they would have this discussion with their physician before they do anything. Benefits of hormone replacement therapy: less hot flashes, less symptoms of menopause, and as well you help to reduce some of the effects that occur, the osteoporosis that occurs when the estrogen leaves, or when the estrogen is reduced in your body. If you have this hormone and it's replaced in your body, what can happen is that this hormone can reduce the effects of osteoporosis, so the bone doesn't become as brittle. Other issues, some people don't think it's worth it, but some people who have horrible horrible effects from menopause do report feeling amazing after using these hormones. Now, in terms of weight gain, recommendations all over the world, they recommend that you should continue to exercise. In terms of your energy, you can try a whole host of different things for energy. In terms of Panax, ginseng, vitamin B, archelian, a multivitamin, which is effective for women, supplemented with iron and folic acid, you name it. There's evidence to show that some of these can actually have a positive effect on your energy levels. But don't stop exercising, because when you don't exercise and you become sedentary, you increase your risk of developing complications of being obese, such as diabetes, hypertension, heart failure, you name it, you can develop it when you're overweight. Now, if you've watched my first video, you will know that I spoke about the fact that estrogen itself is cardioprotective, but hormone replacement therapy also predisposes you to some cardiac issues as well too. So they usually give you the lowest dose possible for you to experience less symptoms and side effects of menopause. So it's not a high dose. So you need to go to a specialist. Don't do any over-the-counter or backyard mess. You have to go to somebody that is trained in this, like an endocrinologist or a gynecologist. Now, I have seen many articles written on black cohosh. Does it work? The research is not really conclusive. A lot of the herbs that are out there that you can try, they are fairly safe, but 100% effective, no. So a lot of people have messaged me asking me about treatments for menopause. I can't give you a 100% effective treatment. The only thing that's fairly good at treating menopause symptoms is the hormone replacement therapy. In terms of what I would advise you to do, if you are a person going through menopause and you want to reduce your risk of putting on weight, here's what you need to do. 5 days for the week, 30 minutes. You need to endure and try to push through some cardio, as well as push through some resistance training, which should be either body-weighted exercises to help build muscle mass, or exercising in the gym, lifting weights at a reasonable weight and as well as a reasonable amount of reps. This is the way that you can help fight your issues that will occur when you are menopausal. Another thing you need to do is make sure that you are in a calorie deficit, meaning if your body requires 2,000 calories, you need to make sure that you are at least 300 calories underneath that. That way you will not be in a surplus and therefore will not have extra calories to store as fat. Then you also need to ensure that you consume lots of vegetables, which should be the green leafy vegetables like spinach, kale, pak choy, Chinese cabbage, you name it, you need to consume it. And when it comes to meats, personally, if I was a female, I would choose fish for now until the symptoms pass. But this is based on an opinion as opposed to science. This is not scientifically backed, so don't quote me and say, well, it definitely works. No, I'm saying, and the reason why I'm saying that is because depending on what kind of chicken you buy, chickens having hormones. Some of the chickens that you buy in the supermarket, they try to market it as pro-hormone free or hormone free. But this hormone in the chicken, you don't know how it's going to affect your overall hormones. So my advice, err on the side of caution. And yes, fish does or people do use antibiotics and all sorts of hormones to farm fish, but then you can just go to your fishmonger or your fish market and get fish. We're in the Caribbean. Get your fish directly from the fisherman. And that way you reduce contaminants in your food. Other things that you should do, try to get 8 hours of sleep per night. I saw even an article saying that yoga helps with relaxation, anxiety. If you're anxious or depressed and you feel as though you're suicidal, you need to talk to your medical doctor. And also you may require antihypertensives, anti-anxiety medication. Don't smoke, stay away from alcohol, and exercise and diet is I'm going to ring it in your ears until we all understand. Exercising and dieting is the best thing you can do for your body. Increasing your muscle mass. Muscle mass is a great determinant of long-term, want to leave there? Okay, it's a great determinant of your long-term survival. Meaning, they use muscle mass to determine how comfortable and how healthy you will be in your latter years, in the latter years of life. So if you're a person who doesn't want to work on their muscle mass, is not a person who gets up and is not active, and your muscle mass shrinks as you get, it shrinks as you get older regardless. So if you're a person who doesn't maintain their muscle mass, you're going to lose it. So you may find that as you get older, you're too weak to walk around. You're too weak to function. You don't want that. So you're going to have to bite the bullet and lift weights. And if you're worried about looking masculine, there's about a 99.99% chance that you will not look masculine. Look on YouTube or Google for the 70-year-old female bodybuilder. Look how she looks. Very feminine, very comfortable. She's walking around, she lifts weights, she runs and she's comfortable because she took care of herself throughout the years. Never neglect your health. Health comes under self-care. If you're a person who is using the excuse that you're taking care of other people because you're taking care of other people and that's the reason why you're unable to take care of yourself, bad excuse. That's great, Pamela. Yes, definitely use weights and body weight. I want to also talk about issues with your thyroid because we're talking about things that slow down your metabolism, which can occur with menopause. Now, your thyroid underneath your neck, a lot of women suffer from hypothyroidism, meaning that their thyroid gland does not function very well. So they end up losing hair, their eyebrows get very, thin. They will notice that their skin gets very dry, which can also occur in menopause. Your skin can be very dry and itchy during menopause. But people will notice that they gain weight and they can't understand why they've gained weight. There's, as I said, skin dry, irregular periods. Periods might not come some months, and then sometimes they might come and run for all 2 months. And that issue can result in anemia because if you're bleeding for 2 months constantly, you can actually end up with symptoms of anemia like headache, dizziness, shortness of breath, feeling tired all the time, heart beating fast. These are symptoms of anemia. So you need to get your thyroid checked as well too. You need to get your heart checked because one of the issues that can occur when estrogen is withdrawn and estrogen is injected is that you can end up with heart issues too. Symptoms of heart disease. You can end up having chest pain, shortness of breath, heart beating fast, ankles swollen. And we're talking both sides being swollen. Walking distances will be difficult for you because the heart is not able to pump oxygen throughout the body. So you're going to feel tired just doing the bare minimum, which is something that can occur with heart failure. And heart disease can occur in people who are menopausal, more so than people who are premenopausal or have not gone through menopause. You can actually go through menopause in your 20s and 30s. As I said before, if you have undergone chemoradiotherapy, you will experience the symptoms depending on where the radiotherapy was done and what impact it had on your body. So it's not just people in their 50s and 50, like in their 50s and 60s who experience 40s and 50s who experience menopause. You can experience menopause if you are in your 40s, 30s, 20s, depending on what was done. And in this day and age where a lot of procedures are done to adjust people's or to, sex changes and all those things, more people, younger people are experiencing menopause than before because of the things that they're doing, the medications that they're taking. Any questions? Any questions? I covered a lot earlier today, but I felt like it was covered at midday, but more people would be able to watch live and ask their questions now because it's in the evening and they're not at work. So giving everybody a chance to ask whatever questions they have. And when you've reached 50, 51, it doesn't mean that you need to neglect your health either. You still have to do all the breast screening. If you have your cervix and your uterus intact, you still need to screen for endometrial and cervical cancer, which means pap smear. Pap smears to be done. Not usually, but I was reading today that because of the lack of hormones, you can actually have some joint pain because of the hormones responsible for the rigidity of the ligaments, if I understand correctly. You have lots of pain in your legs, feeling down most of the days. Yes, menopause can cause joint pains. Not very common, but it can cause pains in muscles as a result of the withdrawal of the estrogen. Things to look out for if you have menopause. 1, if your period went for a whole year and then all of a sudden you started about bleeding, having heavy bleeding, clots, you need to go to a gynecologist and have some tests done because you may either have uterine fibroids, issues with your endometrium, or issues with your cervix. Because it's not normal for your period to go in your 50s a year and then it come back later on. No, something is going on. So you need to get that checked out immediately. So that's a red flag right there. Once you see your period go for a year and then it comes back after a year, get checked immediately. Your period, when it goes, should just do so. Go. Okay, seems like I've answered all the questions. I want to thank you for tuning in. If you have any more questions, you can answer them now. All right, seems like I've answered all. Thanks for tuning in. And if you have any more questions, you can check out the first stream that I did today, this is a bit longer. Hi Marva, you can try Panax ginseng. You may have to try a multivitamin for women, and you're going to have to rest at night, adjust your diet, and that's the only way you're going to get the energy to do these things, but you can't just give up. Arthritis in your back. My advice, you're going to have to do things like cycling. Cycling will help with posture, because for one, when you're cycling, you don't have to worry so much about bending over. You're just cycling, you're adjusting the resistance. You can work your legs, you can work your calves, and that is perfect for you. So cycling is a good exercise if you're a person who has back issues. Don't squat, don't deadlift. That's a terrible idea. Any other questions? All right, thanks for joining. And please remember to like and subscribe and share.